Welcome to our comprehensive guide on Vilazodone side effects and how to navigate treatment for depression. If you're considering or currently taking Vilazodone as part of your treatment plan, it's essential to understand the potential side effects and how they may impact your well-being. Depression is a complex condition that affects millions of individuals worldwide, and finding the right treatment can be a challenging and sometimes frustrating experience. Vilazodone, commonly known by its brand name, may offer relief for some individuals. However, it's crucial to be well informed about its potential side effects to make educated decisions about your mental health care. In this video, we will provide you with a detailed breakdown of the most commonly reported Vilazodone side effects, backed by scientific research and medical professionals. By understanding these side effects, you can better communicate with your healthcare provider, ensure the appropriate management of any adverse effects, and make informed decisions about your treatment approach. Whether you're starting Vilazodone, considering it as an option, or seeking more information about its potential risks, this guide will equip you with the knowledge needed to navigate treatment for depression effectively. Let's dive in. What is Vilazodone? Vilazodone is an antidepressant medication that is commonly prescribed for the treatment of major depressive disorder, MDD. It belongs to a class of medications known as selective serotonin reuptake inhibitors, SSRIs, and works by increasing the levels of serotonin, a neurotransmitter, in the brain. Serotonin plays a crucial role in regulating mood, emotions, and overall well-being. Unlike traditional SSRIs, Vilazodone is a newer generation medication that also acts as a partial agonist of the serotonin 1A receptor. This dual mechanism of action is believed to enhance the effectiveness of the medication in managing symptoms of depression. It is important to note that Vilazodone is available only by prescription and should be taken under the guidance and supervision of a qualified healthcare professional. It is typically taken once daily with food to help improve absorption and minimize potential gastrointestinal side effects. Understanding depression and its treatment. Depression is a complex mental health condition characterized by persistent feelings of sadness, hopelessness, and a loss of interest or pleasure in activities. It can significantly impact an individual's quality of life, relationships, and overall well-being. The exact cause of depression is not fully understood, but it is believed to result from a combination of genetic, biological, environmental, and psychological factors. Treatment for depression usually involves a combination of psychotherapy, lifestyle modifications, and medication. Antidepressant medications, such as Vilazodone, are commonly prescribed to help alleviate the symptoms of depression. These medications work by restoring the balance of neurotransmitters in the brain, particularly serotonin, which is often found to be low in individuals with depression. In addition to medication, psychotherapy, such as cognitive behavioral therapy, CBT, is an essential component of depression treatment. It helps individuals identify and challenge negative thought patterns and develop healthier coping strategies. Common side effects of Vilazodone. While Vilazodone can be an effective treatment option for many individuals with depression, it is important to be aware of the potential side effects. Common side effects of Vilazodone may include nausea and gastrointestinal discomfort. One of the most commonly reported side effects of Vilazodone is nausea. This side effect can range from mild to severe and may be accompanied by other gastrointestinal symptoms such as vomiting, diarrhea, or stomach pain. Headache. Some individuals may experience headaches as a side effect of Vilazodone. These headaches are usually mild to moderate in intensity and typically improve with time or with the use of over-the-counter pain relievers. Insomnia or sleep disturbances. Vilazodone can disrupt sleep patterns and lead to difficulties falling asleep or staying asleep throughout the night. This side effect can be particularly challenging for individuals already struggling with sleep disturbances due to depression. It is important to note that these side effects are usually temporary and tend to improve within a few weeks of starting Vilazodone. If they persist or become severe, it is important to discuss them with your healthcare provider to explore potential management strategies. Managing common side effects. If you experience common side effects of Vilazodone, there are several strategies that may help manage and minimize their impact. Take Vilazodone with food. Taking Vilazodone with food can help reduce gastrointestinal side effects such as nausea. If you experience nausea, try taking the medication with a small meal or snack. Avoid taking it on an empty stomach. Stay hydrated. Drinking plenty of water throughout the day can help alleviate some of the side effects of Vilazodone, such as dry mouth or headache. Hydration is important for overall well-being and can support your body's natural processes. Practice good sleep hygiene. If you experience sleep disturbances as a side effect of Vilazodone, it is important to prioritize healthy sleep habits. Establish a consistent sleep schedule, create a relaxing bedtime routine, and create a comfortable sleep environment. Communicate with your healthcare provider. If the side effects persist or become bothersome, it is important to discuss them with your healthcare provider. They may be able to adjust the dosage or explore other strategies to help manage the side effects. Remember that everyone's experience with medications can vary, and what works for one person may not work for another. Open communication with your healthcare provider is crucial in finding the right balance between managing side effects and achieving optimal treatment outcomes. Rare but serious side effects of Vilazodone. While rare, it is important to be aware of the potential rare but serious side effects of Vilazodone. These side effects may require immediate medical attention and include suicidal thoughts or behaviors. Like other antidepressant medications, Vilazodone carries a risk of increasing suicidal thoughts or behaviors, particularly in individuals under the age of 25. It is important to closely monitor changes in mood, especially during the initial weeks of treatment. Serotonin syndrome. Serotonin syndrome is a potentially life-threatening condition that can occur when there is an excess of serotonin in the brain. Symptoms may include agitation, hallucinations, rapid heartbeat, high fever, tremors, and muscle stiffness. If you experience any of these symptoms, seek immediate medical attention. Allergic reactions. In rare cases, Vilazodone may cause allergic reactions such as rash, itching, swelling, severe dizziness, or difficulty breathing. If you experience any signs of an allergic reaction, seek immediate medical attention. These rare but serious side effects require prompt medical evaluation and intervention. If you experience any of these symptoms, do not hesitate to seek medical help. When to seek medical help. While most side effects of Vilazodone are mild and self-limiting, there are certain situations where seeking immediate medical help is crucial. These include suicidal thoughts or behaviors. If you or someone you know is experiencing thoughts of self-harm or suicide, it is important to reach out for help immediately. Contact a helpline, your healthcare provider, or go to the nearest emergency room for assistance. Severe allergic reactions. If you experience symptoms of a severe allergic reaction, such as difficulty breathing, swelling, or a rash that spreads rapidly, seek emergency medical attention. Intolerable side effects. If you experience side effects that are severe, persistent, or significantly impact your daily functioning, it is important to discuss them with your healthcare provider. They can assess the situation and determine whether adjustments to the treatment plan are necessary. Remember, your healthcare provider is there to support you throughout your treatment journey. If you have any concerns or questions about your medication or its side effects, do not hesitate to reach out to them for guidance. Alternatives to Vilazodone. While Vilazodone may be an effective treatment option for many individuals with depression, it is not suitable for everyone. If you are unable to tolerate the side effects of Vilazodone or do not experience sufficient relief from your symptoms, there are alternative medications and treatment approaches to consider. Other SSRIs. If Vilazodone is not well tolerated or ineffective, your healthcare provider may explore other SSRIs such as fluoxetine, sertraline, or escitalopram. These medications work in a similar way but may have different side effect profiles. Serotonin norepinephrine reuptake inhibitors, SNRIs. SNRIs are another class of antidepressants that may be considered if SSRIs are not effective. Medications such as venlafaxine or duloxetine can help increase the levels of both serotonin and norepinephrine in the brain. Atypical antidepressants. There are several atypical antidepressants available that may be suitable alternatives to Vilazodone. These medications, such as bupropion or mirtazapine, work through different mechanisms and may have different side effect profiles. Psychotherapy. If medication alone is not sufficient or preferred, psychotherapy can be an effective treatment option for depression. Cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and dialectical behavior therapy, DBT, are among the most commonly recommended psychotherapeutic approaches for depression. It is important to work closely with your healthcare provider to explore alternative treatment options and find the approach that is most suitable for your individual needs. Tips for managing Vilazodone treatment. To optimize your experience with Vilazodone and minimize potential side effects, consider the following tips. Follow your healthcare provider's instructions. Take Vilazodone exactly as prescribed by your healthcare provider. Do not adjust the dosage or stop taking the medication without consulting them first. Keep track of your symptoms. Maintaining a symptom diary can help you track changes in your mood, energy levels, and overall well-being. This information can be valuable during discussions with your healthcare provider to assess the effectiveness of the treatment. Stay connected to your support system. Reach out to friends, family, or support groups to share your experiences and seek emotional support. Depression can be a challenging condition to navigate, and having a strong support system can make a significant difference. Practice self-care. Engage in activities that promote your overall well-being, such as regular exercise, healthy eating, and engaging in hobbies or interests. Self-care is an essential aspect of managing depression and can complement the effects of medication. Attend follow-up appointments. Regular follow-up appointments with your healthcare provider are important to monitor your progress, assess the effectiveness of the medication, and address any concerns or questions you may have. Remember that finding the right treatment approach for depression can take time and may require adjustments along the way. Be patient with yourself and trust the guidance of your healthcare provider as you navigate your treatment journey. Frequently asked questions about Vilazodone. How long does it take for Vilazodone to start working? Vilazodone may take several weeks to start showing its full effects. It is important to continue taking the medication as prescribed, even if you do not notice immediate improvements in your symptoms. Can Vilazodone be used in children and adolescents? Vilazodone is not approved for use in individuals under the age of 18. It is important to consult with a healthcare provider to explore appropriate treatment options for children and adolescents with depression. Can Vilazodone cause weight gain? Weight changes, including weight gain or weight loss, have been reported as potential side effects of Vilazodone. However, individual experiences can vary, and not everyone will experience weight-related changes. Can I drink alcohol while taking Vilazodone? It is generally recommended to avoid drinking alcohol while taking Vilazodone. Alcohol can worsen the side effects of the medication and may interfere with its effectiveness. What should I do if I miss a dose of Vilazodone? If you miss a dose of Vilazodone, take it as soon as you remember. However, if it is close to the time of your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not double the dose to make up for a missed one. Can I stop taking Vilazodone abruptly? It is important to consult with your healthcare provider before stopping Vilazodone. Abruptly discontinuing the medication can lead to withdrawal symptoms or a relapse of depression. Your healthcare provider will guide you on the appropriate tapering schedule if you decide to discontinue Vilazodone. Conclusion: finding the right treatment for depression. Navigating treatment for depression can be a challenging and sometimes overwhelming experience. Vilazodone is one antidepressant medication that may offer relief for individuals with depression. However, it is essential to be well informed about its potential side effects and how to manage them effectively. In this comprehensive guide, we have provided you with a detailed breakdown of the most commonly reported Vilazodone side effects, as well as strategies for managing them. We have also discussed rare but serious side effects that require immediate medical attention. Remember, everyone's experience with medication can vary, and what works for one person may not work for another. Open and honest communication with your healthcare provider is crucial in finding the right treatment approach for your individual needs. If you are considering or currently taking Vilazodone, we hope this guide has equipped you with the knowledge needed to make informed decisions about your mental health care. Remember to prioritize self-care, stay connected to your support system, and be patient with yourself as you navigate your treatment journey.